This is always a shared decision making because we got it's a shared decision making on how bad is the toxicity, how much is it affecting their quality of life, and what is their response so far? Because partial response, there's a broad range of that, and also what their goals are. And so, if patients are only a partial response, we don't really have the data. We can't predict who's going to have a complete response. Do we keep pushing them to keep going, trying to achieve that complete response? I think that's a really complicated question. It's something you could discuss with the patient. But from what we've seen, that even patients who had just a partial response and discontinued because of toxicity, they still had durable response. A year afterwards, they still were treatment free, and so it's something that's, I think, definitely possible, and something I think in clinical practice many people or some clinicians do. They do give a pause, and then they kind of just continue to monitor and see how the patients do. And if we have good results and they're unstable disease, then that's terrific, and we can prevent them from having further toxicity.